Have you ever wondered how many staff you should have in your practice? Well, we're going to answer that in this week's tip, so stay tuned. We meet with thousands of doctors every single year, and we talk about their practice and do consultations and try to find areas of the practice that need help and that can be improved or things that are lagging behind. One of the areas that never come up, that I don't get enough questions about, will be how many staff should I have? Most doctors already feel that they have enough staff, that they're overstaffed, that they couldn't possibly take on any more staff. And typically what we find is that's just not true. Here at MGE, what we would recommend is that you should have at least one admin staff per producer, and a hygienist counts as a producer. An assistant is just a helpful person for the dentist. They're not actually a producer. So there are a lot of times that we'll meet offices and they have one doctor, one hygienist, and one staff member. And they're significantly and severely understaffed up front. And because of that, they're missing opportunities. They're missing new patient phone calls. They're not getting time to talk to the patient about their treatment. They're not being able to schedule them. And you got to imagine why that's occurring. Here we have a patient who is coming up from the back and it's time to talk about the treatment plan, but I've got a patient walking in, I've got Blue Cross Blue Shield on hold, I've got a new patient calling. We've got to let one of those things go. So I know we feel like we are already perfectly staffed or possibly overstaffed, but you must have a minimum of 1-to-1. The ideal scene, the ideal scenario, the ideal ratio that we talk to our clients about is about 1.5-to-1. 2 is the maximum. The smaller you are, the closer I find the offices to be to 2-to-1. As you grow and you get economies of efficiency and scale and all these other things, you will get closer to 1-to-1. But you are trying to expand your practice, you're trying to grow, you're not going to do it by cutting off the amount of people that can handle the flow of the practice. And that is one of the most critical things about having a successful office. We need a team there to help get the patient healthy. That means answering the phones, getting them in, making sure that they're showing up, checking them in, getting them to the back. When they come up front, going through all of the necessary steps to get them onto the schedule or get them reappointed. And then, unfortunately, reactivation. So don't do what every dentist does. Pinch pennies on the staff. I know that we are looking at expenses, but by not spending a little bit more money on some staff members, we're missing a lot of opportunities. So take a look at your staff. And if you find that you're not at that 1.5-to-1, let's have a talk. Where are we losing our efficiencies? Because that really is the problem. There's a lot of other inefficient areas in the practice that are not allowing us to hire the proper amount of staff. Why you need the proper ratio of staff is to get to expansion. And if we think about that from just a numbers point of view, if you have an office that's doing 25 new patients every single month, that's 300 patients in a year, that's 1,500 patients over 5 years, we should be adding days of hygiene. We should be adding staff to help handle that amount of patient load. So if you are adding that many new patients and you're not adding days of hygiene, you're not adding staff, it means as many patients are leaving that are coming in. And that could be a direct relation to the amount of staff you have to handle the practice. They can only do so much, guys. So please don't get penny wise, pound foolish here. We want to hire somebody. It's better to have someone there $20 an hour, $25 an hour at the front desk, get one more new patient phone call every single week. It'll pay for itself. So take a look at that ratio. If you're into expansion, then we should be looking at hiring more staff, getting closer to that ratio. And we should be hiring staff all the time. We're always looking. We're always growing or we're shrinking. And we never stay steady state. So guys, that's my tip of the week. And if you need any help with it, let me know. Reach out, click the link below, book a consultation. It's completely free. And as always, hit that like button, hit subscribe so you can get our tips in the future. See you next time.